About 95% of the patient encounters I think I had were when I was working in facilities had to do around wayfinding. People lost, couldn't find their way. And two things, we had an example that was kind of interesting. So we were out looking at the wayfinding for the new heart hospital, and we were looking at all the entrances and how are we going to re-sign everything and make sure people can get to where they need to go. And as we were out walking the campus, a woman who's in labor, getting ready to have a baby, drives up to the loading dock because the sign said deliveries.
Oh,
And
yeah.
My goodness.
she showed up at the loading dock, and we're like, oh my gosh. And I think as facilities folks, the one thing is like, do you need me to get you in the car with you and get you to the right place? Or do you want me to drive you? Why don't you get in the passenger seat? And I'll drive you to the right place, make sure you're dropped off and bring your keys into your whatever, if you're willing to trust me. But it was all of a sudden we had this aha moment where it's like, this is really, really important because wayfinding it can either make or break the patient experience. And I would always be the one who, if I was late to a meeting, they knew it was because I was helping a patient find where they needed to go, because I wouldn't just give them directions like walk down the hall 100 feet and take a left and then take another right and take another. I would say, you know what, let me take you to where you need to go. And so I would always make sure I got them exactly where they need to go, and so they didn't have to navigate and remember all these instructions, because most people, when you're in a hospital, you're outside of your comfort zone. Many times you're not there for something that is a regular procedure or something, and so you're distracted, and throwing a bunch of instructions to somebody doesn't work.